3. Healthcare AI agent architectures, from input to action. Healthcare AI agents are sophisticated, multi-layered systems designed to process vast amounts of medical data, adapt to dynamic clinical environments, and provide actionable insights that optimize patient care. The architecture of these agents is structured in layers, each serving a distinct function but interconnected to work as a cohesive system. By processing information in these distinct layers, AI agents can make decisions and take actions that are not only contextually relevant but also personalized, efficient, and effective. Below is an in-depth exploration of the key layers in the architecture of healthcare AI agents, using examples from the 7 types of AI agents to highlight how each layer functions. 1. Perceptual layer. Input. The perceptual layer is the foundation of any AI agent, converting raw data from multiple sources into formats that can be processed and analyzed. In healthcare, this layer is crucial because it handles inputs from a wide range of medical devices and data sources. These may include electronic health records, EHR, lab results, diagnostic images, such as X-rays or MRIs, sensor data from wearable devices, such as heart rate monitors, and patient communications, e.g., voice or text. For example, in React AI agents, the perceptual layer processes medical imaging data, such as X-rays, and diagnostic results, extracting features that the agent uses for further decision-making. These images might show abnormalities like tumors or fractures that need to be incorporated into the agent's decision-making process. Similarly, LLM-enhanced AI agents rely on this layer to process unstructured text data from patient records or consultation notes, converting this information into structured, machine-readable formats to support natural language processing (NLP) tasks. Tool-enhanced AI agents might gather real-time data from various devices, such as wearable ECG monitors, to detect early signs of arrhythmia. The data is then transmitted to the eye for real-time monitoring and decision support. The perceptual layer's role is to ensure that all these diverse inputs are correctly interpreted and prepared for deeper analysis. 2. Contextual layer. Memory. The contextual layer integrates memory systems, which store and maintain patient data over time. Memory systems are integral for healthcare AI agents to ensure continuity of care, allowing them to recall past interactions, diagnoses, treatment histories, and other relevant information. This memory enables the agents to adapt their actions to the unique needs of each patient, ensuring personalized, consistent care. For instance, memory-enhanced AI agents store detailed patient histories, which might include previous diagnoses, treatments, and response patterns to medications. This allows the agent to make more informed decisions, such as adjusting medication dosages or suggesting alternative treatments based on the patient's history. In cases like Alzheimer's disease management, the agent can recall changes in cognitive function and suggest interventions that have previously worked. Self-learning AI agents also rely on memory to evolve and improve. These agents continuously adapt their models based on interactions with patients and historical data. For example, a self-learning agent working with a diabetic patient could store information on blood sugar levels, treatment adjustments, and outcomes over time, learning from this data to make more accurate predictions about the patient's health trajectory. In both these examples, memory systems allow the agent to retain and use contextual information from previous interactions, ensuring decisions are based on a comprehensive understanding of the patient's health journey. 3. Predictive layer. World models. The predictive layer, powered by world models, is responsible for simulating possible future outcomes based on available data. Predictive models in healthcare AI agents simulate how a patient's condition might evolve, taking into account their medical history, treatment responses, and other relevant factors. This layer is essential for proactive decision-making, allowing healthcare professionals to anticipate potential risks and intervene before issues become critical. For example, React plus RAG AI agents use world models to simulate treatment outcomes in real time. If a patient with cancer is undergoing chemotherapy, the world model could predict the likelihood of tumor reduction based on the specific treatment protocol, patient data, and external research retrieved via Retrieval Augmented Generation, RAG. These models allow the agent to predict treatment responses and suggest modifications based on the most current evidence available. Similarly, self-reflecting AI agents use predictive models to analyze past clinical decisions and adjust future strategies. For instance, if a self-reflecting agent helps manage a patient with a cardiovascular disease, It can simulate the potential effects of a new medication on the patient's blood pressure or heart function, adjusting recommendations based on past outcomes. The predictive layer's ability to simulate patient outcomes helps healthcare professionals make decisions that are more aligned with long-term health goals, reducing the likelihood of negative surprises and improving patient care. 4. Executive layer, cognition. The executive layer is responsible for decision-making and planning. This layer synthesizes insights from the perceptual, contextual, and predictive layers to guide the AI agent's actions. The executive layer processes the inputs, integrates them with stored data and predictions, and formulates a course of action. This is where the agent's cognitive abilities come into play, as it evaluates all available data and makes decisions based on the most relevant information. For example, in React AI agents, the executive layer could determine the most appropriate course of action when diagnosing a disease, factoring in patient symptoms, medical history, and predictive models. If a patient presents with ambiguous symptoms, the agent would use both structured reasoning, e.g., diagnostic algorithms, and unstructured reasoning, e.g., chain of thought inference, to determine the most likely diagnosis. Self-learning AI agents continuously refine their decision-making models in this layer, adjusting strategies based on new data. For instance, a self-learning agent that helps manage a patient's chronic pain might adjust pain management protocols based on patient feedback, the effectiveness of previous treatments, and real-time data from wearable devices. This layer ensures that the AI agent is able to plan and make decisions in a way that aligns with the goals of patient-centered care, ensuring that all actions are based on the best possible evidence and predictive insights. 5. Motivational layer, reward and emotion. The motivational layer combines reward systems and emotion modeling to prioritize tasks, modulate urgency, and ensure that patient-centered care is maintained. This layer is crucial for guiding the agent's focus and determining which actions should be prioritized based on their potential impact on patient outcomes. In React AI agents, for example, the reward system reinforces the agent's decision-making abilities by rewarding it for actions that lead to positive patient outcomes, such as accurate diagnoses or effective treatment plans. The agent is continuously updated with feedback based on clinical results, ensuring that its decision-making process improves over time. Emotion modeling is integrated into this layer to ensure that the agent's actions remain sensitive to the patient's emotional state. In telemedicine, for instance, the agent may detect signs of anxiety in a patient's voice and adjust its responses accordingly to provide reassurance. This emotional sensitivity helps build trust and ensures that the agent's recommendations are well received by patients. The motivational layer helps guide the agent in making decisions that prioritize patient well-being while also improving its overall effectiveness through feedback-driven learning. 6. Execution layer, action. The execution layer is where decisions are translated into real-world actions. This layer is responsible for turning the agent's plans and recommendations into tangible outcomes, such as ordering tests, initiating treatments, or even modifying the healthcare environment in real time. For example, tool-enhanced AI agents might use this layer to trigger the automation of medical processes like ordering prescriptions or scheduling follow-up appointments. These agents can also integrate with external tools, such as robotic surgical systems, to perform precise operations or make adjustments during procedures. Environment controlling AI agents, another example, use this layer to adjust physical factors in the healthcare setting, such as room temperature, lighting, or patient positioning during surgeries. For instance, a robotic surgery assistant might adjust lighting based on the surgeon's needs or position the patient more optimally for a procedure. This layer ensures that the AI agent is able to not only provide insights and recommendations but also carry out the necessary actions to improve patient care, whether through automation, direct intervention, or environmental control. IV. Potential healthcare AI agent applications. Healthcare AI agents are transforming every aspect of the healthcare system, enhancing clinical care, administrative efficiency, research, patient engagement, and operational management. With their ability to analyze vast amounts of data, make predictions, and provide personalized recommendations, these agents enable smarter, more efficient, and patient-centered care. Below is an expanded and comprehensive list of AI agent applications, grouped logically to align with modern healthcare practices across various domains. 1. Clinical decision support. AI agents play a pivotal role in assisting healthcare professionals by providing real-time, evidence-based support in clinical decision-making. Diagnostic assistance. AI agents analyze medical images, X-rays, MRIs, CT scans, to detect and classify abnormalities like tumors, fractures, and other medical conditions. React AI agents assist clinicians in diagnosing complex conditions by analyzing patient data and suggesting diagnostic pathways. Treatment planning. AI agents evaluate clinical data, such as medical histories and current health conditions, to recommend personalized treatment plans. These agents help ensure that treatments are tailored to individual needs, leading to improved patient outcomes. React plus RAG AI agents. These agents retrieve up-to-date guidelines and evidence-based research in real time, ensuring that treatment recommendations are always aligned with the latest clinical standards. Clinical decision-making. In specialties like oncology, cardiology, and neurology, AI agents provide clinicians with decision support by analyzing patient data and suggesting the most effective treatment options. 2. Patient monitoring and care. AI agents are enhancing patient monitoring through wearable devices and offering personalized support to improve patient engagement and long-term care. Remote patient monitoring. AI agents track real-time health data from wearables, e.g., heart rate monitors, glucose meters, and provide alerts if any anomalies are detected. Tool-enhanced AI agents help monitor chronic diseases such as diabetes and hypertension by collecting continuous data, ensuring timely interventions. Virtual health assistants. Self-learning AI agents act as virtual assistants, providing patients with guidance on medications, lifestyle changes, and health maintenance. They offer personalized reminders, ensuring that patients adhere to treatment plans. Behavioral health support. AI agents track behavioral health data to monitor mental health conditions like depression and anxiety. They can adjust therapeutic interventions based on real-time data, improving patient engagement and treatment adherence. 3. Diagnostics and medical imaging. AI agents are revolutionizing the diagnostic process by automating the analysis of complex data such as medical images, lab results, and genetic information. Medical imaging. React AI agents and tool-enhanced AI agents analyze medical images, X-rays, MRIs, CT scans, to detect conditions such as tumors, fractures, and lesions. These agents enhance diagnostic accuracy and speed, helping healthcare professionals detect abnormalities early. Genetic testing and counseling. AI agents analyze genetic data to identify mutations or genetic disorders. Tool-enhanced AI agents provide insights into hereditary conditions and offer personalized treatment recommendations based on genetic profiles. Pathology slide examination. AI agents assist pathologists by analyzing tissue samples, detecting anomalies such as cancer cells, and providing real-time feedback to improve diagnosis accuracy and speed. 4. Personalized medicine. AI agents are at the forefront of personalized medicine, tailoring treatment plans and healthcare strategies to the unique characteristics of each patient. Genomic data analysis. Tool-enhanced AI agents interpret genetic data to identify potential risks for various diseases and recommend personalized treatment plans. By understanding a patient's genetic makeup, AI agents can suggest the most effective therapies, reducing the trial and error approach in treatment. Predictive analytics for personalized treatment. Self-learning AI agents analyze patient data to predict the likelihood of disease onset and the most effective treatment strategies. These predictions enable early interventions and personalized care, improving health outcomes for patients with chronic conditions. Precision nutrition. AI agents personalize diet plans based on genetic, metabolic, and health data, helping manage diseases like obesity and metabolic syndrome. Self-learning AI agents can adjust nutrition plans based on ongoing monitoring and health data, optimizing patient wellness. 5. Prevention and public health. AI agents are increasingly used to predict disease risks, improve vaccination efforts, and monitor public health trends. Predictive analytics. AI agents analyze vast datasets to predict disease onset and identify patients at high risk for specific conditions, enabling proactive health management. For example, AI can predict the risk of cardiovascular diseases or cancer and recommend preventive measures to reduce the incidence of these diseases. Immunization tracking. Memory-enhanced AI agents track vaccination schedules and send reminders to patients about upcoming doses. These agents help improve vaccination rates and ensure that patients stay up to date on immunizations, reducing the risk of preventable diseases. Disease surveillance. AI agents monitor disease patterns in real time and provide early warnings of potential outbreaks. These agents are crucial for tracking the spread of infectious diseases like COVID-19 and can predict the effectiveness of public health interventions. 6. Research and development, R&D. AI agents are revolutionizing the speed and efficiency of medical research, aiding in drug discovery, clinical trials, and genomics. Genomic and biotech research. AI agents analyze genomic sequences to identify biomarkers, genes, and pathways associated with diseases. These agents support research into rare genetic conditions and personalized treatment strategies. 7. Clinical trials. AI agents are streamlining the clinical trial process, from patient recruitment to trial monitoring and protocol optimization. Patient recruitment and screening. Tool-enhanced AI agents help identify eligible participants for clinical trials by analyzing patient data and matching them to specific trial criteria. This improves recruitment efficiency and ensures better trial participant outcomes. Trial monitoring and data analysis. AI agents track patient responses during clinical trials, ensuring compliance with protocols and providing real-time data analysis. This enables researchers to make adjustments to the trial design and treatment regimens as needed. Regulatory compliance. AI agents ensure that clinical trials meet regulatory standards by automating documentation and ensuring adherence to guidelines. Tool-enhanced AI agents streamline regulatory reporting, reducing the administrative burden and improving the overall efficiency of the trial process. 8. Drug discovery and development. AI agents are instrumental in accelerating drug discovery and optimizing the drug development process. Drug discovery. AI agents assist researchers in identifying new drug candidates by analyzing large datasets, including genomic, chemical, and clinical data. Tool-enhanced AI agents predict molecular interactions, speeding up the identification of potential compounds for therapeutic use. Regulatory compliance for drug development. AI agents ensure that drug development processes comply with industry regulations by automating documentation, ensuring clinical trials follow protocol, and tracking progress in real time. This reduces the time required for regulatory approval and accelerates the introduction of new drugs. 9. Patient support and engagement. AI agents improve patient engagement by providing continuous support, enhancing communication, and fostering better health outcomes. Personalized patient engagement. Memory-enhanced and self-learning AI agents offer personalized health advice, medication reminders, and lifestyle recommendations based on a patient's medical history. These interactions improve treatment adherence, promote long-term health, and enhance patient satisfaction. Virtual health assistants. Self-learning AI agents act as virtual health assistants, guiding patients through their treatment regimens, answering health-related questions, and offering ongoing support for managing chronic conditions. These assistants can track progress and suggest adjustments to care plans. Health education. AI agents curate and provide personalized educational content to patients, empowering them to manage their health effectively. By offering up-to-date information on disease prevention, treatments, and wellness, these agents enhance patient understanding and engagement. 10. Doctor support and workflow optimization. AI agents support healthcare providers by improving clinical workflows, optimizing decision-making, and assisting in patient care. Surgical robotics. Environment controlling. AI agents integrated into robotic surgery systems adjust surgical environments in real time, ensuring optimal conditions for surgery. These agents enhance precision, reduce the risk of human error, and improve patient recovery times. Healthcare training and simulation. AI agents simulate complex clinical scenarios for medical students and professionals, providing real-time feedback on their decision-making skills. This improves training efficiency and prepares healthcare workers for real-world situations.